Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello, everybody, and welcome back. Today, we are going to be talking with Dr. Hannah Brandt, who is a physical therapist initially and then has gone on to do some other things. And so welcome.
Thank you so much for having me. I am so excited to be here.
Perfect. Well, tell us about yourself and your journey as part of physical therapy.
Absolutely. So I went to a school for physical therapy and I graduated a generalist and went right into outpatient orthopedics. And I spent the first probably just over 8 years of my career doing just that. I had started working in Columbus, Ohio, and that's where I was from. And then my husband and I moved to San Diego. I practiced there clinically. And eventually that transitioned into what I do now, which is a full time health and fitness coach, which is a virtual kind of nutrition and fitness coaching business for women. And I do that full time now with a team.
Nice. Okay. So tell us about physical therapy. What had drawn you to that?
This is probably one of my favorite questions because I don't have a good answer. I realized I had a terrible answer to this question when I was interviewing for physical therapy school. I went into undergrad knowing that I was always drawn to healthcare. I was interested in the medical field. I liked biology. I liked the human body. And I liked I could help people with this. And I wanted to get to know my patients by their name and what was meaningful to them and why they were seeking healthcare. And so I never really resonated with short-term relationships in regards to hospital clinical care. And physical therapy just kind of checked all the boxes. And I just started pursuing those classes. And so I found myself interviewing for physical therapy school, never having had physical therapy myself. Never one time had I ever been a patient. And I will never forget sitting in this group interview and just like the guy before me. So we all went in a row and it was the question, like, why do you want to be a physical therapist? The kid next to me, bless his soul, like he had everyone in tears. His younger brother was never going to walk again. I mean, it was like the most heart-wrenching story. And then the chairs turned, they're like, and Hannah, why would you like to be a physical therapist? I'm like, that's not fair. Like no one can follow that like that. And I was just honest. I was like, I'm drawn to the field, not even having been a patient. And I just kind of listed I like those reasons. Like I don't want to know someone by the room number they're assigned to and like their medical ailment. I want to know, Jim Jones, who has shoulder pain when he's throwing the baseball with his son and he just wants to get back. Like that's what just always resonated with me, always having been in athletics. So it just felt like a good fit. And I just never stopped pursuing it.
Got it. Do you think that you got that experience within your training of physical therapy, that you actually did get to know a patient beyond their ailment for today?
I do. And I also, when I was in physical therapy school, the timing was perfect. I found myself in need of physical therapy. So I got to be treated by a couple of my professors at the time. So it was kind of, I really, not that anybody ever wants to have physical therapy, because that means something typically went devastatingly wrong. But it was nice to be able to understand what the patient felt, which helped me develop that rapport and truly understand the questions to ask and get to know my patients. And also just reading the room, a lot of my patients did want me to get to know them and why they were doing these things, what was meaningful, why they wanted to get back into triathlons. And it was maybe this long-term pipeline dream of theirs. And then there were some that were just a little bit more buttoned up and they weren't there to share as much. And as a clinician, it's our job to read the room and understand that just because maybe I want to get to know you better doesn't mean that that's what everyone wanted. So most patients did fall into that category, but also had to respect that not everyone just wanted that banter with their healthcare provider.
Mm-hmm. In terms of the going to school and learning the trade of physical therapy, what's that like in terms of hours, requirements in terms of study time, impact on ability to do other things within your life? Tell us about that.
Um, the single most oppressive thing I've ever done. It is so challenging, and I wouldn't change it for
Mhm.
anything. It was the hardest time, the hardest 3 years. It's a 3-year program typically. The hardest 3 years of my life by a large margin, the most stressful by a large margin. I don't think there's enough money in the world to ever make me go through that again, but I don't regret doing it. I met some of the most amazing people. The professors were supportive. I cared about what I was learning, but in regards to having time for anything else, that's just non-existent. We were stressed beyond stress. So I typically, my stress shows up in physical manifestations where I grind my teeth in my sleep. And I was actually waking up and finding like little pieces of teeth in my mouth. I was grinding my teeth so aggressively with how high my stress was. I had at least 5 of my classmates on walking heart monitors, usually kind of like they would like rotate in and out just because they were getting heart palpitations. Like sleep doesn't happen. It is so stressful, but there's this camaraderie among like your classmates that like you're all in this together. And I really enjoyed the fact that there was no competition. We all wanted everyone to get through. It wasn't like, well, if you get through, I can't get through. So it was very much a let's rally together in the probably hardest 3 years of our lives and let's
Mhm.
make it through.
Yeah, I find that interesting. My husband didn't complete physical therapy, but he did the first 2 years of physical therapy while I was doing the first 2 years of med. And
Woo!
when I would go visit him on his campus, it was totally different. Like they were hanging out during lunch, chatting, playing pool. I think it was pool. It might have been table tennis. And they do like undie runs around the building because they weren't shy of showing their bodies to each other because they did that all the time as part of the who won pool or didn't win pool, compared to med students who were taking too many Sudafed so that they could keep awake during the library and studying all hours and getting DVTs. It was terrible. So it
So
was
I'm
like,
like, where did he go to physical therapy school? My experience sounds much more like yours. I mean, I think where I went to grad school, it was Ohio University. It's in Athens, Ohio. It's a beautiful campus. But oh, the one layout that just drove me crazy is, I mean, we would typically, I mean, you go to class all day and then you try and eat something and then you have your coffee at about 8 p.m. So you can stay up until about 2 to study, get about 3 hours of sleep and repeat. Like that is just how you're functioning. And where you parked to get to the library, once all the classrooms were closed, it was you parked and you were walking up this hill to get to the library. That is where all the undergrad people were walking through to go out for the evening. So they're all dressed, out for the bars, going out to dinner with their friends. We look like trolls carrying backpacks that weighed more than we did, like dragging it up the hill to the library. So my experience sounds a lot more like yours. Why did he drop out? He sounds like he was having a great time.
yeah, he was having a great time. Just he had different priorities, and that's okay. But yeah, the experience going to his campus versus my campus was like so different. I'm like, these guys have it right. What am I doing wrong?
And we had to laugh. We shared a bus. Like for some reason, a lot of us ended up at the a similar apartment complex, and it typically would bus us in. And was so we were the doctoral physical therapy students. We also there was also a lot of master's business students. They always looked to us because like your husband did experience, like we needed to be in lab attire because we were so used to like learning from each other's bodies.
Yes.
So we would be sent back if we were in business casual to go change. Like we needed like sports bras, athletic wear, and they're like the people we're sharing the bus with were in business, like ready to go into basically a courtroom every day. And like we look like we just rolled out of bed and they're like, wait, you guys are working on your doctoral degrees? We're like, yes, that's right. It was, and but then like we graduated, so like you have this degree and you kind of learn halfway through that you're like, well, you definitely don't go into physical therapy to make a ton of money. Like that is definitely not the driving motivator there. And we learned that what's the PAs, physician's
Mhm.
assistants, their program is shorter than ours and they come out, just a little bit more financially sound than physical
Mhm.
therapists do. And of all places, I was on an anniversary trip with my husband and we were sitting at a restaurant. Like we were sitting at like this like open long table. And this guy that sat down next to me, my husband went to the restroom. We start chatting he has his PA. We knew weirdly similar people. And he's like, man, like halfway through PA school, I wish I went to PT school because you guys get like the name, like you're the doctoral degree. And I was like, funny, everyone in PT school halfway through wishes we went to PA school because we'd be done and we'd be better off. Like it's this funny like parallel where grass is always greener.
Yeah,
But I
yeah.
do feel like in healthcare, there's just always a mutual camaraderie. Like we worked very hard to get here.
Yeah, yeah. What about the transition into them working? What was that looking like from a point of view of getting some of your life back? Any improvements?
Market improvements. It was wild. I didn't know what to do with my time. I floundered a little bit. Just I feel like, and I can't speak for all,
Hmm.
healthcare professionals who pursue higher education, but like that is your only motivator for so long. I mean, like, yes, like I love my parents, I love my family, like I had other passions, but they just had to be deprioritized because there was like one driving force. And it was like, this just has to be everything for the time being. And so when you graduate and like you go to work and you want to give great quality care to your patients, but then like you clock out and you're like, I don't have to go study right now. Like I didn't know what to do with it was weird for a while. You almost kind of lost your identity because you were like in pursuit of higher
Mhm.
education. And then they just plop you out and now you're done. You're like, what happens now? So I like that's ended up when I started my health and fitness journey, just because I graduated with, the doctoral degree. I had like I went into orthopedics. I educated so many of my patients on like the importance of like, a healthy lifestyle, movement, exercise. But ironically, I graduated grad school at my heaviest weight. I had always struggled with my weight and it just climbed and climbed and climbed as I prioritized school. So it like I ran out of things to kind of do in regards to studying. So I was like, well, I guess now I'll just start focusing all of that effort onto me, which kind of kickstarted the journey that started my business. But I don't know if you found it a little bit odd leaving school in that structure to be like, oh, and like we get a paycheck now? Like, what is this?
Well, the thing is though, the when you graduate PT, I don't know if you went into private practice or if you were working for like within hours, but the problem is the clinical day was not a daytime hours as we
Mm.
graduated from physician school, because now we were doing really long days, getting paid for it now, but really long days, nights, on call. Like it just kept going. You're like,
And that
I'll
that is, I
finally,
think,
I'll get that degree and then I'll have all this time. And then you're like, I've been duped. There
you're like,
isn't any.
Is there a memo I missed? Like, this is not what I signed up for." And like that's I think where your and I's trajectories changed.
Well, you just keep in the groove of this requires my all potentially.
Mhm.
Like and this is why um when the things that you're doing now, which is that we need to figure out the time where you will look after you, because this tunnel of medicine. This is when I graduated and became intern. So this is my first year of working, and our first week of orientation. This wonderful intensive care specialist, and I think I might have said this on the podcast before. He said, "Listen, medicine's like a big long tunnel that never ends. Don't actually get out of the tunnel, it will just consume everything like a black hole, like literally a black hole." And he had the foresight, I think, after years of this constant everything, that he would take his annual leave and spread it out over the year. So he would have Fridays off for band practice. He
Oh,
loved being in
wow.
a band, rock and roll band. Dr.
Good
Phil
for him.
Hungerford, such a great guy.
But he
Really
probably
learned so
couldn't be a
much.
motivational speaker. That does sound like a very depressing statement.
Well, it was a depressing statement. And it was a reminder at the very beginning of our career that you think you're out of the hard part now because you've got this tick doctor, and you're not. The hours continue, and then the paperwork mounts higher if you're in that chronicity of seeing patients and not keeping up with the work of the day, that it would then come home with you. So you would have like this, you could work 24/7 if you wanted to and still not be
Yeah.
done. So there wasn't
And
this like,
unforgiving.
oh, I have all this time. That would have been wonderful. Some specialties may have, but certainly not certainly not the first few years out. And then the decision on your career also can create some of that constantness. So The
Oh, absolutely. That is definitely where our trajectories change, and that was part of my rationale in, like, with physical therapy school, and I do remember a when I was starting to, like, get a little bit interested in, like, later in high school, and I'm like, maybe what am I going to major in college? And I remember a friend of mine I grew up with, I knew her for a long time. Her dad was a surgeon. I forget his specialization.
Mhm.
And he was like, why don't you just be a real doctor? Like that was a lot of the feedback that I got. And, I had toyed with it, or like just even just like other avenues. And I didn't like the idea of always being on call because I'm very type A, and I'm one where like I give my all to everything.
Mhm.
And I'm like, if I choose a profession where there is no ever stepping away, even a little bit on like a
Mhm.
somewhat consistent basis, like I will lose myself in that process. So I definitely like I fully respect what you had to go through. One of my best friends in the world, I've known this girl since the third grade. She did her MD, PhD, and then she did her residency. And then I think she's now in her second or third fellowship. I stopped counting, and she's even like, I don't even know what's going on anymore. She was like, it just keeps going.
It just
And
keeps going. You're either a resident or you're working, but it can just keep going. That constantness of it will be all consuming unless you put some boundaries around it. So yeah, interesting. Tell us then about, so if you're giving your all in the room and you're getting to know your patient and you're providing therapy and you're providing this detailed education, what about the documentation then? So how would that happen?
that was a challenge. So it was very different. My first job in Ohio, I was salary there. And
Hmm.
so they have like a little bit different like labor laws and whatnot, but if you're salary, like you just have to get the job done. So that it was a great first job for me. It was a high volume clinic. I saw everything from headaches to toe surgeries and
Hmm.
everything in between. And so it was I learned a lot very quickly, but I typically would have to stay about an hour and a half to 2 hours after every day to finish documentation. And
Hmm.
the charts, even with that, you'd kind of like we were still doing handwritten charts at the time,
Hmm.
but they would just kind of pile. And we were not
Yes.
allowed to take the charts home. They had to
Yes.
stay within the clinic. So one of the other clinicians there, we had a standing Friday morning date. We would
Mhm.
get to the clinic 2 hours before it opened with coffee, and we'd lay out on the mats and try and catch up with our notes from the week before Friday started. So it was like when I was salary in that job, it was you work through lunch, you chart before, you chart after, you try and write some things down like during the patient session, especially like, subjective rapport and
Mhm.
things like that. But I mean, especially when you're doing hands on treatment, you just can't. So that was slowly killing me. I did like,
Mhm.
that's when, like, like, as a clinician, my stress was getting very, very high just because, like, at first it was like, yay, I have time on my
Mhm.
hands. But then as like your caseload starts to grow and it got to a point where my stress was not well managed and I started being a little bit vocal about it. I was like, we're double and triple booked with patients.
Mhm.
We're here like very, very late. And it was always met with, well, you want your patients to get better, don't you? They have to come in and see you. And I'm like, well, I think that just means you need to hire more people. Like there's a lot of people in here. And it was a time where I feel like I had gotten everything I could out of that
Yeah.
position. And
Yeah.
I just wasn't able to provide the quality of care that I went to school to provide.
Yeah.
So I was in a position where I was like, I'm either going to look elsewhere for a company that maybe has a little bit better boundaries around like how much time I'm able to spend with my patients, how many patients I'm managing all at once.
Yes.
And instead of looking in Ohio where I was, that's when my now husband and I ended up moving to San Diego. And that's where I learned how different California labor laws are as
Mm.
compared to Ohio. And you're hourly in where I was in California and where I was in Ohio, it was a franchise and it was a standalone orthopedic clinic.
Mhm.
Where in San Diego, I was working for an orthopedic clinic that was affiliated with a hospital. So I
Mhm.
had hospital requirements. I did, acute care like on like a rotating weekend shift, all of those kinds of things, which was like nobody ever wants to wake up on a Saturday and go to the hospital. But I did enjoy kind of tapping back into that skill set. But there, it was because you were hourly and just their labor laws are different. You are not allowed to document off the clock. You are not allowed to document at lunch, and
Mhm.
they don't want you to stay into overtime. So there was documentation built into our schedule, which
Mhm.
was like something I had heard of like that was like
Mhm.
it was like a mystical creature, like
Mhm.
documentation time. So I got the giggles interviewing for that job because I thought they were kidding. I didn't know they were serious. Like some I don't know how they hired me. Like got the giggles in the interview and like tried to keep it together when they were talking about documentation time and like you're not allowed to document during lunch and like we don't want you staying after. I was like, "What? What is this?" It was
What
so
is this
different.
magical employer who's thought about me?
Yeah, like they were very much about employee satisfaction. Of course, there were productivity standards. They had high standards and whatnot, but the day I started there until the day I left and I was moving to where we are here in Nashville now to be closer to family, we had usually a standing 3-week wait list. It was a good
Mhm.
clinic. They didn't double book you. It was well run, but they did. I mean, it's a business as well. You have to meet productivity standards, but
Mhm.
it was night and day, like moving from a
Mhm.
salary position to hourly and actually have documentation. And then when I was in San Diego, we had moved. I was part of the transition moving from paper charts to electronic,
Mhm.
where we ended up hooking up with Epic. So that did make it a little bit faster when you could kind of move your little kiosk around with you because it's a
Mhm.
little bit easier to like type and look at someone than like writing in a chart.
That's so fascinating. Going back to your salaried position, so you're salaried, so it didn't matter if they double booked you or you saw like half the amount of patients, you were getting the same amount of money.
Oh yeah. Oh,
Okay.
exactly the same. And 'cause the way they
And it didn't
justified
matter if
it
you
was like
stayed 2 hours late or came in early on Friday, same amount of money.
exactly, and because they're like, "Well, if you know your last 3 patients schedule, you can leave." I'm like, "Who's leaving? We have 6 hours of charting to do." But that
Okay.
was kind of their justification.
And then when you were in school and they were getting you to see patients, you were presumably documenting while you were doing that.
When I was a student physical
Yeah.
therapist, yes, I was documenting on the appropriate charts. I'm not sure how it looks now, if it's any
Yeah. Oh,
different.
no, no, that's okay. We're just talking about your story.
Well, just like so when I was a student, we couldn't be the ones treating
Yes.
Medicare
Okay.
payers. So
Yes.
if it was like a non-Medicare patient, I would be like doing the appropriate treatments and documenting, and then my what was called our clinical instructor would then like read and then also co-sign with me.
Okay.
But just when you have a student, I was very aware they were responsible for less patients because there was
Yes.
a lot of explaining to do for
Yeah.
me. But as soon as they discovered if you were a competent student, you both had caseloads you were running
Mhm.
side by side. So then you just set up
Yeah.
your little documentation station after with your instructor and you just both
Yeah.
sat there and wrote everything down.
And what was your feedback from instructors regarding the amount of documentation, the volume of documentation? Like, what sort of feedback were you getting during training?
They told me I wrote down too much.
Okay.
That
Okay.
was
And
I
I'm
wanted to be
curious.
thorough.
Yeah, I'm curious about that because it's so interesting that coming out of this program and then you hit the salaried position and your documentation is spilling into the after hours. And so you're not dissimilar to how our residents are coming out of training programs as well without the skill set of I see patients and close charts.
Oh yeah, that does not happen.
Right. And it can. And isn't that fascinating that even while you said, "My life was amazing and so much better than it had been," and wait, I had actually, if I added up, at least, you know, 6 to 8 hours outside of the clinical time to catch up on the work of the week.
Oh, easily. I think in contrast to how challenging grad school was, it was still a breath of fresh
Oh,
air,
yeah,
but then
yeah.
once you were assimilated into that lifestyle, you kinda start looking around like, "This doesn't feel right either."
Mm. And so for you, it was, rather than the adapting the day, it was the, "Get me out of here. This is not good for me."
Yeah, I tried to adapt best I could. I tried to get better about writing down things when it was appropriate when I was working with a patient, like instead of just, always maintaining rapport and like counting them through exercises. If they were very competent and they had a couple like more repetitions, try and write something down really quick. I did my best to try and do my part. But yeah, there was definitely always spilling over. And eventually I did realize that it wasn't I didn't go to school for that long and take out that much debt to
Mhm,
be that overworked
mhm.
all the time.
Yeah, well, certainly double booking you was not going to be helpful with regards to getting the day done within the clinical day. That would have been much more challenging for sure. Yeah.
Oh, absolutely. Especially just if it was, a few patients that maybe I had been treating for a while, they were getting a little bit closer to being appropriate for discharge, a little bit more like exercise based. That wasn't a problem, but the scheduling staff didn't know who was being seen for what. So if they double booked two fall risk patients, I was like, this cannot happen. I need to be like with one, not two. Like it definitely didn't always iron out
Hmm.
seamlessly.
That also then challenges your original goal of getting to know your patient, having the time to educate them, having that ability to know who they were outside of their injury or their risks that you're managing. That's kind of how you had arrived at this career. And now they're like, back to back 10-minute appointments. Let's go.
Oh yeah. It was a kind of a rude awakening. It was like in grad school we were painted this like magical little picture of like what we could do as clinicians and we all graduate like we're going to save the world. And like fast forward 9 months later you're like what is happening? It didn't sit as well as I thought it would, and like which is kind of why I've left full-time clinic work now, and like being a health and fitness coach, I'm able to spend as much time as I want on each client, and it's really nice to be able to do that without the confines of productivity standards and having someone else like up in the waiting room, or like if someone even in San Diego where I worked, I loved that clinic. I had great clinicians, I had great support. It was just a wonderful place while I was working there. Even so, like we were booked one-on-one always, which was
Mhm.
wonderful. They were 30-minute treatments and we had significantly longer for evaluations for new patients. But if your 10 a.m. showed up 8 minutes late and your 10:30 is on time, you're like, you have to decide if you want realistically a 20-minute treatment for the same copay, or we have
Mhm.
to reschedule. I mean, it was a very tight ship. So we kind of told them
Mhm.
from day one, like, you gotta be on time. We don't have wiggle room because there's no overlap.
Mhm. Yeah, yeah. Um, Interesting, because physician visits are typically one-on-one, and not always, but in most environments they are, and they have that same um, the patient's been booked in for this many minutes. Now what when they turn up 10 minutes late? And how are we going to navigate that? And what is the communication to the patient? And who's doing that? Is it going to be you or is it going to be your staff? And what are the rules? And having that think about it kind of broader than just you in the moment with the patient. Like, do I
Mhm,
give
and
you a
I
20-minute
think
treatment or are we sending you home?
but also like for your world is it's frustrating on your end because you want to be able to have those quality conversations with your
Mhm.
patient, but you're so booked solid that
Mhm.
by the time you get into that patient room, they probably showed up to the appointment already expecting you to be running late, and then once you get in late, they're already a bit irritated. So any meaningful conversation, they're not going to be maybe as receptive because they haven't had the best experience like minding their time. So it does seem like a very kind of unideal situation for all parties involved. One of my former clients in my health and fitness business, she is a primary care physician. We work with a lot of healthcare providers. Just myself and my two coaches, we're all from healthcare. So like we kind of all speak the same language, and a lot of what her and I had to talk about was, like having different expectations of like what her self-care looked like on
Mhm.
her 12-hour days in the clinic versus a day that she wasn't in the clinic. But
Mhm.
like these are the things I'd hear all the time. And she's like, you try to have these meaningful conversations. You have 8 minutes with this person. And if you don't just give them exactly what they're demanding of you within 15 minutes, you have a bad Google review while they're just sitting in their car in the parking lot. And she's like, what happened here?
Yeah. Yeah, the challenges. It's challenging. Long hours, confines of whatever that clinical day looks like, plus the documentation pieces and the other like in basket pieces. Like it is. It's a big, big day. So tell us then about the way that you added in your personal priorities for you within your clinical days.
It was something that had always been a priority was my weight management. I mean, from my earliest memories, I had always struggled. I remember sitting in the doctor's office as a kid, they pull up the graph of your weight going up over, and I'm like, this isn't helping, doesn't make me feel good. And I felt like I was doing, the right things, eating the salads and like trying to exercise. And it just I was just not seeing much success. So it was easy for me when I was in school to quote hide behind I'm focusing on my career and like my studies. I just always focus on that, but it always bothered me. And
Mhm,
once I was out of grad school, yeah, I was working still a lot with,
mhm,
we covered documentation, but I had more time than I did when I was in grad school. So I used the little time I had to start working on my own health and fitness. And by being a lot more intentional around eating, not just like, oh, I eat salads because they're healthy, but eating enough food,
mhm,
eating protein, and like exercising more, I started to have more energy. Even with my long work hours, I was like, huh,
mhm,
I'm doing a little bit more now and I'm starting to feel better. So what I started doing was I treated my own health and fitness, my workout schedule, my like going to the grocery store. I kind of set up my own schedule that I prioritized as high as a treatment or patient evaluation. So for me, I know myself.
mhm,
No part of me ever had energy after a full day of clinic work with working with patients to then go to the gym or go on a
mhm,
workout. Like I no, I would rather sell my left arm. Like absolutely not. So I knew I had to do it before the clinic. Were the hours unforgiving? Absolutely. But the way I made sense of it in my brain was I feel more energized throughout the entire day if I keep the promise to myself first. So I'm like, if I had a patient scheduled at 5:30 a.m., I would be there without
mhm,
question because we care about what we do as healthcare providers. So I'm like, why would I show up for a patient at 5:30 a.m., but why won't I show up for myself then? So to me, it was like that mental shift.
mhm,
And like and that this is kind of all where it started in my first job is every Monday I was a 12 hour. I was a 7 to 7. That was and but realistically it was more of like a 6 to 8. It was a very long day. So I knew realistically that day, I didn't have time to get in a formal workout. I was lucky to put shoes on. So
mhm,
I didn't have those same expectations of myself on that day. So I made sure on the other days that I prioritized it. And to combat my like really long day in the clinic, I had one shorter day where I got off at noon. So always when I got off at noon, I would first go to the gym and then I would go to the grocery to get what I needed for like the rest of the week. So I started to kind of structure my schedule almost like my patient care hours were structured
mhm.
because I wanted to make sure that I was important too.
Yeah. I think the adaptation to medicine is that looking ahead either today or this week, because sometimes our schedules are changing and sometimes they're stable. And if we're doing a lot more call, then there might be some differences week to week that we need to adjust for. But it's that decision that you have more energy when you've had the ability to do movement in the way you like to do it, which sounds like for you it was the gym.
Right, and, like, other like, for now, like, current me, sometimes that looks like walking my dog. It doesn't always have to be, like, such a formal workout,
Mhm,
but I started paying attention and realizing that I didn't have to reach for, that afternoon coffee to get through the rest of my shift. If maybe that morning, I got up earlier, but I had exercised, I ate a balanced breakfast, maybe I did, have coffee in the morning, but then also didn't just skip lunch, just to get charting done, is I can write and eat at the same time. Like, and
mhm,
I started realizing that I felt better even with a demanding schedule by doing even like the bare minimum things, like exercising a little bit more, drinking a little bit more water. And I was this may sound odd, but I was also just more tolerant of the busy schedule. It didn't bother me as much. If it
mhm.
was like maybe like the feeling when you get there and like your last patient is canceled, you're like, oh darn. And then all of a sudden they slide someone in. It didn't bother me as much. I was just genuinely in a better mood. I didn't mind running it. Everything just felt a little bit more smooth in my life
Mhm,
when I wasn't running on E all the time. And it made me want to lean more into that direction. It's one of those where it sounds counterintuitive, as healthcare providers, like we're busy, we're tired, we're overworked. Get up earlier to work out. Like it's like, are you out of your mind? But I did it enough times where I started seeing the benefit and I couldn't unlearn it.
Yeah. And I think you're right that it didn't need to be perfect and at the gym every day. Like it could look like water and nutrition in that middle of the day, right? It could look
Exactly.
like walking the dog to get those extra steps in could be better than not doing that.
Exactly. I teach a lot of my clients. I'm like, all or nothing is a very like common character trait to bring toward health and fitness and our own wellness. But all or nothing always ends in nothing. So we really lean into all or something. Just
Right.
something, just scratching that itch a little bit, which is why I literally have a membership that is all about healthy habits. There are no structured workouts, there are no rigorous rules. It is literally like checking off, let's get in some steps, let's get in some protein, vegetables, are you sleeping, and water. It is the like basic fundamentals as a human. Let's just try and hit those consistently enough.
Mm-hmm. Yeah. I know that the schedules when they are, when you're in that run of schedules where you're doing, it feels like every other night or every other shift, or you've just had a run of really big shifts, and you feel like you've got zero left. Like tank empty, empty, like running on fumes and pushing the car. It feels like you're pushing yourself along. Then we go even back to, pocket snacks so that you can eat on the run. How can we make them a little bit better for you? And water, like where can we put a water bottle somewhere in your vicinity so that you're not having to keep pushing that physiology away, because it's going to create this tiredness, this stress physiologically that is just even worse. Like it's creating even worse than what you're having to go through from those hours. So yeah,
I couldn't
really.
agree more. I really, and I, there, ironically, she wasn't a healthcare provider. One of my former clients, she was a principal and started a school from scratch. Like it was the most wild journey I've ever experienced. She was on the go so much that half of the time, like most of our conversations were planning lunches that she could eat with one hand while walking. I'm like, is this optimal for digestion? No, but it's better than eating nothing. So the amount of things that we came up with that she could eat in one hand while walking was like we started to laugh about it, but that really is the nature of it. It's like, why don't we do a little bit just so we don't hit that bottomed out running on E, just like you said, like that level of tired. That's the level of tired where coffee doesn't even touch you. It just makes you jittery. So then you're tired, jittery, and you're mad about it. Like no one wins. Like it is a shame that, many healthcare providers, we find ourselves in the position where we can't even try and healthcare provide for our own selves
Mm-hmm.
because our schedule is so demanding.
Mm-hmm. Yeah, yeah. I think we need that list of one-handed lunches. The
Exactly.
one-handed lunches handout.
There are some very weird, sketchy, but she says they were pretty good, like little like chicken pouches where she would just like, like take like a little chicken nugget at a time. She would just open her pouch and be walking down the hallway with her chicken nugget pouch. I'm like, okay, sure. And just finding a bunch of good quality bars, all those things, little bit goes a long way.
Mm-hmm. Beautiful. All right. How can people find you if they're interested in learning more about what you're doing now?
Yes, absolutely. I have a website. It is the name of my business. It is hlblifestyle.com, where they can learn a little bit more about my over 60-pound weight loss journey and just kind of what online coaching actually is. And on all the various social media platforms, I am at Dr. Hannah, Dr. Hannah health coach. And I'm so much an open book if anybody wants any, you know, advice on how to get through physical therapy school or how to manage their time after, or as a busy healthcare provider, how to find a little nugget of time to just start doing a little bit of something that is truly like myself and my two coaches. I have another physical therapist that works with me and a pharmacist as well, and we are so passionate about helping. We specialize in working with women just try and fill up their cup at least a little bit more and a little bit more, just because we seem to prioritize everyone in our lives except for ourselves. And then we wake up one day shocked that none of our favorite clothes fit. We're tired all the time. Our hair's falling out. We have bags under our eyes and we're shocked. And we're trying to help women fix that before they feel like they're so far gone that they don't know the way back.
Mm-hmm. Yeah. Yeah. As I was saying, the journey of medicine, for instance, it can feel like that tunnel of doom where you really don't get a break ever. It can feel like you're constantly 24/7 working, or the demands of kids and home and everything in addition to your clinical day. And it really is that purposeful reminder of you matter too. And you don't want to end your medical career saying, well, I missed out on my health, I missed out on fun, I missed out on pleasure, I missed out on fitness. It's part of how can we give you a little bit more of that now, even when your days are so demanding and your days are long and your other responsibilities are in there as well. So yeah, so hopefully these have been good nuggets and pearls for people to just think about how they can look after them too a little bit more within their day. So yeah.
Yeah, I do hope so. I do feel like social media nowadays makes it seem like if you can't get in, a 2 hour long workout and have the world's most perfect nutrition, it's kind of a why bother mindset. But when we look at it like through the lens of healthcare, if someone has, let's say, a medication regimen and maybe they forgot their morning thyroid pill, fasted, is it better for them to maybe still take it when they remember a couple hours later, or say, why bother? I'll get back at it next week. That would be silly if a patient did that. So it's kind of sometimes reframing our logic to make it make sense in a different way.
Yeah. Anything we didn't talk about that you wanted to talk about before we end?
Really, I think just something that I struggled with personally as a healthcare provider when I was struggling with my weight was I assumed that because I had, a doctoral degree in physical therapy, like I assumed that I didn't need help with my own health. And I was struggling for a long time with my weight. I had nothing but, 10 years of failed diets to prove that I really didn't know what I was doing. And I finally had to realize that at the time, now it is, but at the time, my expertise was in rehabilitation, physical therapy, the human body. It wasn't weight management, it wasn't weight loss. And the more I start working with healthcare providers, charge nurses, like just because you have a degree in healthcare and you are wicked smart and you're great at what you do, that doesn't automatically mean that you have an expertise in personal health, wellness, weight loss, weight management, nutrition, fitness. That's why there are people like me. And as someone who was like, I went to school forever, I hired a personal trainer to help teach me these things. And I learned so much. And it's realizing that just because you're a healthcare provider doesn't mean you, quote, should know what to do and you need to hold yourself more accountable, because that very thing is what often keeps most of us stuck, because that's actually not our area of expertise. And I fell victim to that for a very long time.
It's so interesting. The I should know, or I should know
Mhm.
better, or I should be able to do this on my own. Um, when did you start with that personal trainer? When did you come to the realization that I need someone else? What did that look
It,
like? What was happening?
it was after grad school and when I was starting to, see the benefits of like feeling more energy. I was starting to work out more, starting to eat a little bit better. I was feeling physically better, but my weight was not moving. And to say I was frustrated and annoyed is an understatement. I was so mad. So mad. I'm like, what am I missing? Now I like on social media, I'm like, what are these what do people know that I can't seem to grasp? Like, I'm eating the healthy things, I'm eating stupid protein, I'm going to the gym. Like, I feel good, but I don't look like I'm doing those things. And it bothered me. It truly, even as a healthcare provider, I'm like, I don't even look the part. It's like, what is going on? And so a friend of mine at the time had been working with this online fitness trainer. And I was like, I've never heard of it. And she was like, I'm getting great results. I didn't think twice. I was like, I'm in. I just signed up with this guy. And it was a terrible experience. So
Mm.
I had been not getting results on my own. I hired this guy and it was an online virtual service like I offer now. And he was not supportive. I did not get results. I was, again, so frustrated. So I'd maybe been out of grad school by at least, I don't know, 9 months at this point. And I found a different trainer and someone that I had, like, I scoped out a little bit more, had a couple conversations around the level of support. So it was within a year of graduating that I was just tired of trying all by myself, quote, doing all the right things
Mm-hmm.
and having no results to show for it outside of like having more energy. That was so wonderful. But I knew there was like, there was something else I could tap into. So within a year of graduating, I had finally hooked on with a trainer who doesn't even do it anymore, but working with someone to like look straight at me and say like, okay, what are your goals? What are you doing? This is what you should like approach nutrition from. Like, here are your workouts. No one had ever customized it to me. I had always just followed generic advice: work out, eat healthy foods, eat less, do some cardio. Like, I was
Mm-hmm.
using little like snack size nuggets of like health and fitness information and trying to make a program for myself out of them that wasn't working. So it was probably about 9 months after physical therapy school is when I hooked on with a trainer that ended up helping me lose over 60 pounds. And I just started looking very different when I would post, date night with my husband. So people that used to know me before I had lost the weight asked for help. And I was like, absolutely. It wasn't
Mm-hmm.
as hard as I always thought it had to be. And it just kind of snowballed from there.
Got it. Yeah. Yeah, that makes a lot of sense. It's helpful to understand that even if you reach out to someone and you're using them and you're still feeling frustrated, it doesn't mean that you've either found the right way or you found the right person. You haven't done anything wrong. It's just that, maybe not the approach I need. So interesting
Exactly.
and good information. So yeah, wonderful. Well, thank you so much for being here. Have a wonderful rest of your day and we'll see you next time.
Thank you so much for having me. I really, really enjoyed the conversation.
Me too. Bye. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the Premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.